Dr. Harpal Bains from Harpal Clinic. I'd like to talk a little bit about our patient's journey on TSM. It's one of those things I think a lot of people read on forums. You hear someone who's talking on YouTube videos about their fantastic experience, and it's a little bit difficult to gauge what it really is like, and so I thought I'll share some of our patient stories with you. So typically someone comes to us and we get them started on this method, not just purely for the naltrexone, but we also do quite a lot of supportive help alongside it, which has to do with nutritional care, their diet, stress, and also liver, to make sure that their liver is taken care of at the same time. We find that, this is what most of them tell me, when they first start out on this journey, it can take anything from a couple of days, and to some of them it takes a few months of being fairly consistent with taking naltrexone for them to actually find that there is an effect. And so it's one of those things where if it doesn't work for you straight away, don't lose heart, because in some people it can take a little bit longer than those few days. We do find that a lot of people find that within a week itself, they do find that they do get changes, and this can go on and on. And what happens, this is pretty much what they tell me all the time, that they will have a drink, 1 or 2 drinks, and then they find that they don't even finish the second drink. Some of them don't even finish the third drink, and they just don't have the desire anymore. And this is absolutely great. Now, within our clinic, we do find that we have around a 25% rate where people don't find that it doesn't quite work for them. There are a few reasons why this could happen. One of them, we find that it's because when they haven't come by themselves, it's someone else has brought them in, which usually a family member, which is great, but I think you do need to want to come in for this to be successful. We have a small number of patients where I think they don't wait it out long enough. They give up too quickly. As I said, in some people, we have even heard, I think the longest I've heard is someone who's been on it for about 6 months, and only after that did it start working. There's a small number of patients who are so encouraged, everything's worked so brilliantly, that they give up too quickly after beyond just a few months. In their heads, they think they can do it by themselves, and then they stop using naltrexone and thinking that it's going to be okay. And it's a little too soon. A few months is too soon, keeping in mind that it takes years and years and years for these addictive qualities to develop. I generally tell people to think about it as a thick rope. The thick rope is comprised of many thin threads, and every single time you get a hit of endorphins, that's another thread. And so to break something that's taken years is not going to be months, 2 or 3 months. It's going to take quite a long time to break these addictive tendencies. Then there's also that small number of patients where, for whatever reason, naltrexone doesn't work. In those cases, we generally look at different options like nalmefene, baclofen, and there are quite a few other options even besides this. But it's a case of, we are happy to work with you, but let us work with you. It's a two-way street. We need to work together to get there.